You arrive on scene to find a patient complaining of chest tightness, shortness of breath, and feeling of overwhelming fear. Their heart is racing, they appear restless, they keep saying, "I feel like something terrible is about to happen." This patient may be experiencing an anxiety or panic episode. Open and clear. So ideally we may Anxiety is the body's natural response to stress or perceived danger. It activates the body's fight or flight response, which prepares a patient to react to a threat. During an anxiety or panic attack, the body releases stress hormone like adrenaline, which increases heart rate, breathing, and alertness. While anxiety itself is not usually life-threatening, its symptoms can closely mimic serious medical conditions. Common signs and symptoms of anxiety include rapid breathing or hyperventilation, increased heart rate, chest discomfort, dizziness or lightheadedness, sweating or trembling, a sense of fear, panic, or impending doom. Some patients may also report tingling in the hands or face, which can occur during hyperventilation. Even if anxiety is suspected, EMTs must rule out medical causes first. Serious conditions such as heart attack, asthma, hypoglycemia, or hypoxia can present with similar symptoms. Begin with a primary assessment, checking airway, breathing, and circulation. Obtain vital signs, assess oxygen levels, and gather patient history, including recent stress, medical conditions, and medications. Treatment focuses on support and reassurance. Speak calmly and confidently. Let the patient know they are safe and that you are there to help them. Encourage slow, controlled breathing to help reduce hyperventilation. If oxygen saturation is low, administer oxygen according to protocol. Continue monitoring vital signs, reassessing the patient during transport if needed. Anxiety and panic attacks can be frightening for patients, but your calm presence can make a significant difference. Remember, always consider possible medical causes, provide reassurance, and monitor the patient carefully. Your assessment helps ensure that serious conditions are not overlooked.